And in parts of Texas, COVID infections continue to push ICUs to their limit. Just this week in Dallas, Parkland Hospital opened a third ICU ward to deal with the crisis. Our producer Jim Schultz and photojournalist Juan Renteria spent time with the doctors and nurses from the medical center who spoke out about what they are seeing on the front lines.
I think what's hard about it is you never know what to expect. Every day is a little different. It's always busy.
You know, to give you an idea, 4 weeks ago, I had about 50 patients admitted in my hospital. Now we're over 110. We're definitely going the wrong direction.
I just worry that what's to come 2-3 weeks from now.
My gut tells me we're not at the end. We're kind of at the beginning.
Testing effort continues in Dallas.
Pulled up to Parkland. It's about 6 o'clock. We're here, just finishing up some coffee, about to head on in. You know, coming into this unit was scary, but within the first few weeks, we all have felt very safe.
Here's all the masks. So we all pick up our scrubs. We've got some booties and hairnets. We get our shield and our mask. Ready to go.
You know, they've put safety at the front of everything. The process to get in and out is, you know, very rigorous. There's people watching us at all times to make sure that it's done correctly. And I think it's kind of proven by the lack of people that have gotten sick, you know, in the staff, that, you know, we are safe and we are protected.
Our temperature before we go in and sign in. Let's enter. Let's enter the red door.
At first, I think we were all somewhat fearful going into the unit, not knowing what to expect, this new disease. But every day that you're in there, it gets easier. Sure, it's long hours, but honestly, I feel safer in there with the proper PPE that Parkland has supplied, and I feel safer in there than I do anywhere else.
First temperature check. We get our temperatures checked about 3 times a day.
We have a specialized COVID ward. We created what we called our tactical care unit here. We're very proud of our results here, but we've outgrown it. We've had to open another ward. And then yesterday we had to open a third.
I never expected doing anything like this. This is unlike anything any other day of work has ever been. But, you know, it's been a cool thing to be able to be a part of and to be able to be hands-on and, you know, really helping these patients who really don't have anyone else, you know, helping them there in the hospital without family. And so I'm glad that I can be there for them in those times.
Every day kind of blends into the next day, if you will. There are some days where we'll have codes or we'll have patients that just get really bad really quickly, and those days are harder than others.
These patients who are spending their last days, their last, you know, weeks, months in the hospital without family, without, you know, any support from their loved ones is so hard. And I think that's what makes it really hard on us, but also rewarding, because we know that, you know, the family can see us we do Zoom calls with them, talk to them on the phone, all those kind of things, and to be able to show them that we're there, we're holding their hand, we are with them at all times, even if it's the end of times for them. But, you know, they're not alone. We are there, but it is really hard not to have their family there.
I wanted to show you guys the family visiting area. Of course, family can't come into the units, but we do have an area that at night, when you can see into the windows, there is a garden out here that family can go. And if the patients are able to walk up to the window, they are able to wave and, you know, see their family. Although we try to have them see each other on Zoom, it's kind of nice to be able to see them in person.
I wish people could see both people that are about to be intubated, but even before that, when people are just in a little bit of distress from breathing, just the fear in patients' eyes, it's hard to take in. Just looking at them, you can tell that they're just so fearful. They don't know if they're going to see their family again. You can only imagine what they're thinking. All right, so it's the end of the day. I finished my notes and called the families of some patients of mine to give them updates about their loved one. And 5 of my patients are going to be able to sleep in their own bed tonight, which is incredible. They were able to go ahead and get discharged. And looking at our admission list, though, there's already over a dozen patients being admitted because of their COVID-related illness.
How can we slow this down? Guys, wear your masks, wash your hands. It's those things that we have science on. This is not in dispute. We know these things for facts.
You know, gasping for air, throughout the entire day is not a comfortable feeling, and it is very distressful. And I think it feels like you're about to die all the time.
Wearing the mask is not just for yourself, and you know, it's really for everybody.
All right, just finished day 205. Ready to go home, take all this PPE off, and I'll be back again tomorrow morning.
Windy and hot and humid, mid to upper 90s.
And a big thank you to all of our healthcare workers risking their own lives to care for so many there on the front lines.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.